Very lecture I'm going to explain the angle of the Lewis or the sternal angle, right? So in order to know about the sternal angle, first of all you should know the very basic anatomy of the sternum, right? So the superior most portion of the sternum is called what? The manubrium, and then we have the middle portion of the sternum, that is called the body of the sternum, and the inferior most portion is called the xiphoid process, right? So this is the interior view of the sternum actually, right? Now if we will look at the sternum from the lateral aspect, that is from one side, then we will able to see the sternum like this, right? So this is we have the manubrium, right? This is we have the body, and this is we have the xiphoid process, right? Now as you can see in this very picture, there is a slight angulation between the manubrium and the body of the sternum, right? As you can see, there is a slight angulation, right? This very angle is being formed between the manubrium and the body of the sternum, right? This very angle, right? So this very angle is called what? This very angle is called the angle of the Lewis or the sternal angle, right? Now the sternal angle, what is the numeric value of the sternal angle or the angle of the Lewis? It is about 162 degrees. It is about 162 degrees, right? Now as you can see in this very picture, the sternal angle is formed at the level of the manubriosternal joint, right? This is formed at the level of the manubriosternal joint. It is formed at the level of the manubriosternal joint, right? Now, you can identify the angle of the sternum in a living subject by putting your hand on someone's sternum. You have to slide, first of all you have to put your hand at the jugular notch. This very notch is called the jugular notch. This very notch actually, right? First of all you should put your hand on the jugular notch, right? Then you should slide your hand down the sternum, right? Now at the level of the manubriosternal joint, you will able to appreciate a lump. There will be an outgrowth, right? So that very outgrowth is basically called what? The angle of the sternum, right? This is an identification, landmark for the angle of the Lewis or the sternal angle, right? Now, the sternal angle is very much important in the topographic anatomy, right? There are some very important structures that you can find at the level of the sternal angle, right? Now, at the level of the sternal angle, there is the attachment